We're just going to jump right in. So I'm so glad y'all were able to come and attend the Inland Empire Master Plan for Aging on the road to aging well. We're going to talk about partnerships today, specifically the housing one. Um, so first, we're going to give a little background um, about the master plan. So today's agenda, we'll talk about the Inland Empire MPA and how we got here. We'll talk about like the timeline and how we progressed to this point and where we're going forward. We'll talk about the IE-MPA framework for implementation, which is where all y'all come in as partners. Then we'll go on to discussion and opportunities for partnership, and we'll kind of brainstorm some ideas about what that currently looks like and what it can look like. And then we'll discuss some next steps. So we can go to the next slide. So the IE-MPA, or Inland Empire Master Plan for Aging, complements the California Master Plan for Aging, which is a 10-year blueprint for promoting healthy aging and supporting quality of life. This was launched in January 2021 by the Newsom administration under a state executive order N1419. So that's the state master plan. They had five bold goals, is what they called them. Um, and there's currently groups that are working on this state master plan, and then they're working in conjunction with these regional master plans. The state bold goals are housing for all ages and stages, health reimagined, inclusion and equity, not isolation, caregiving that works, and affordable aging. And that's for the state of California. But as you'll see, when we talk to people within our region, we had slightly different priorities that were important. So we can go on to the next slide. California MPA released the MPA Local Playbook. It's a guide for local communities to create their own master plans for aging. It could be cities, it could be counties, it could be coalitions of cities, or it could be groupings of counties. And these master plans for aging within these more local specific environments are to meet the unique needs of community members. So they were able to create a really nice guide for all of the regions in California who wanted to engage in this master plan implementation and designing process. Uh, and it's really nice too because it's this playbook is also being used as a template for other states too. So this is part of a bigger national movement. And I believe the SCAM Foundation did research on the other states that are in the process of implementing them. California was ahead of our time with creating this master plan, and there's several other states that are following suit and at different points in this master plan implementation. I don't know how many of them have released their own local playbooks, but I do know that individual cities and regions across the US are creating these local specific master plans as well, regardless of if the state's part of a bigger movement. And so we're going to go on and talk about what is a master plan. So we've talked about that a lot, like the master plan for aging. What does this look like though? It's a multi-sector approach. So it's not just one sector, it's looking at many sectors, which is why we are holding partnership discussions for people in transportation. People are interested in housing and behavioral health and caregiving and Alzheimer's. So we're making sure to loop in as many sectors as possible because it's a multi-sector approach to transforming our human service system to meet the needs of the community as we age. And in California, we're incorporating a disability perspective too. So it's not just people who are aging, but it's those who are facing disabilities because all of us are aging together and using similar resources. And when we think about partnership for this master plan, whether it be for the state one or for our local ones, partnership includes government, private entities, community-based organizations, and also nonprofit sectors. So it's looping in all of these groups to work together. It's not strictly government-led, it's not strictly private or nonprofit-led. It's looping everybody in together so that we can work not just across sectors, but across different types of organizations to coordinate our efforts to make these communities better for those who are aging and experiencing a disability. Priorities for master plans include, but are not limited to, housing, long-term care, or long-term services and support, sometimes referred to, caregiving, transportation, community safety and livability, legal services, healthcare, and financial security. And so this isn't an exhaustive list. These are some sectors and priorities that we can focus on. But the list can go on. It can include recreational opportunities, because recreational opportunities unite people who are wanting to be social and wanting to create those support networks. So this is some, but not all of the opportunities. But why is the master plan so important for the Inland Empire? Why did we create our own specific plan for the IE, San Bernardino and Riverside counties? Well, the next slide is going to give us a little bit more information on that. So there will be a 682% increase in those 65 and older in the IE by 2060. It's the largest increase in the state of those who are 65 and older. So it's really important to have a plan in place of how to make a community livable to this population and to improve the resources and access that are needed. And San Bernardino and Riverside counties are very unique. There's very populous areas, there's very rural areas, there's a lot of state land. So there's a lot of different ways that we can go about improving resources and access for this population that's going to exponentially grow. And so the plan is also really important too, because being prepared is important. And knowing that this is going to happen and figuring out a plan ahead of time so that we're all not taken by surprise. Can go to the next slide. So as part of this process for creating the master plan for aging for the Inland Empire, we formed a coalition. The coalition was really formed in 2008 and it was previously called the IE-LTSS Coalition, or the Inland Empire Long-Term Services and Support Coalition. The mission is to improve integrated care and service delivery of long-term services and supports in the Inland Empire. And the vision is a community where older adults and adults with disability and caregivers as well, because they're included in this group, are able to have the support that they need. And so, like I said, it was previously called the IE-LTSS, but we have since changed the name to the Inland Coalition on Aging because it more clearly reflects what we're talking about and how we can draw it together. We've got a chair in Ben Hadigi. Our secretary is Anna Swartz from the Community Access Center. Our treasurer is Carmen, who is here with us today. And we also have representatives from both of the counties, San Bernardino and Riverside. And so it's truly working across the counties to collaborate on this process. So we can go to the next slide. How did we get here? How did we get from the process of talking about this a huge increase in population of those who are aging by 2060 to deciding to create this master plan and actually creating it? Now we're at the implementation stage. So in January 2022, we received funding from the SCAN Foundation to develop this master plan for aging. And in 2023, in May, we received a grant from the California Department of Aging to continue that process. So the first grant from the SCAN Foundation focused on a needs assessment, figuring out what existed within the Inland Empire And we also spoke to community members, figuring out where their challenges were and where they were excelling with being able to find their needs met. And the second grant, which is the one through the California Department of Aging, specifically focused on creating working groups surrounding important topics that we uncovered in this needs assessment, and then figuring out ways that we can actually actively implement the feedback within our communities. And we're doing that through partners, so that's why y'all are here. In September 2023, we released the IE-MPA recommendation report, which is the needs assessment, essentially. And in 2024, we began developing the implementation plan to work on implementing 4 key topics. And we worked with working groups that had representatives from San Bernardino and Riverside counties. We had representatives from government, from nonprofits, from private sector, all participating in these working groups to figure out these goals for the master plan. And then in 2024, we released the implementation plan as a draft framework. Some of y'all, I'm sure, were at that conference in September. And it was very good, and we were able to hone it down with your feedback and to develop it into a tangible plan, which we'll be releasing in June. And so we can go on to the next slide. The needs assessment and these working groups were guided by an advisory committee. You may recognize some of these people on the advisory committee. They're very active within the community in various ways. And specifically for housing, we have Tanya Torno, who is one of our chairs of the housing working group, who is a representative here. Next, we'll talk a little about the needs assessment to give you some background on how we arrived at these recommendations. So the needs assessment was conducted August 22nd, or 2022 to May 2024. We held quite a few community listening sessions. And we also were able to intake some external surveys from our local tribal communities. We spoke with informal caregivers who spoke both English and Spanish. We spoke with those who identified as LGBTQIA, African American community members, and those who are Hispanic and Latinx. We spoke with veterans, and we also spoke with low income and unhoused community members. And those were very impactful. On the next slide, you can see a little bit more about the data that we collected. And keep in mind that the needs assessment, we intook a lot of data. We intook information from these focus groups or listening sessions where we were able to get at a lot of nuance about people's experiences because we had in-depth conversations. We also did an inventory of all of the resources that were available within the counties, too, by public and private entities. And so we incorporated that into the needs assessment as well. So we collected information in these focus groups on 6 key topics. And the next slide will give us some information on those topics. We talked to community members during the focus groups about transportation, housing, healthcare, behavioral health and social support, Alzheimer's and all other dementias, and also caregiving and the process of caregiving. We got a lot of feedback in various ways. For social support, people have community members around them who are passing away, and so their social circles are shrinking. When we discuss extending life, it was important for community members to talk about quality of life, just not simply how old one lives, but also the quality of them living to that age. We talked a lot about transportation, and transportation and housing go hand in hand. If we stay in California, we can't stay in this area because it's too difficult with lack of transportation. We spoke with a community member out in the high desert about this topic. And then we also spoke with disabled individuals about needing to be a legal library in all ways to know when their rights were being violated and also to actively advocate for their rights in all ways. But overall, people are not taught that they were going to age and that they had to plan for aging. And that was something that was really important that came out of these focus groups, the importance of planning for aging. And that's what the Master Plan for Aging in the Inland Empire is here to do. And so we took this information from the needs assessment and we brought them to our working groups. And our next slide tells us a little about these working group chairs. So we had four key working groups. We collapsed caregiving and Alzheimer's disease and other dementias into one working group. But the one that we're going to be focusing on today is housing. Ben Haggerty from Inland Empire Health Plan, IE-HP, was one of our chairs, and Tanya Tornow from Housing and Workforce Solutions from Riverside County was another of our chairs. And they were able to help lead a discussion to narrow down these uh, information that we were able to compile in our needs assessment and these recommendations from our working groups. We narrowed them down into 5 key goals. Um, and our goal for housing, there we go, is considering housing as both home and health care. We have 4 other goals: transportation for all ages and abilities and regions, focus on caregiving, Alzheimer's disease and dementias, age and disability friendly behavioral health and social support, and safety, respect, and equity as we age. Today we're going to focus on the housing topic, but if any of these other topics interest you or you think that your work or somebody in your office's work may align with these other topics, I want to encourage you to attend the other meetings. There's quite a lot of overlap, and so I think it could be useful to attend and see the ways that we can work across these 5 goals. Also, everybody here, I encourage you to attend the final partnership meeting. It's on April 14th. It's on safety, respect, and equity. We didn't have a specific working group for this topic, but after all of our discussions within working groups, and especially with the community, this was a really important topic. And so we integrated it as a key goal within the Inland Empire Master Plan for Aging. And so we need to rally community members around this and providers and nonprofits and anybody who's interested in this safety, respect, and equity topic to come and attend and figure out how we can work on this element together. But we're going to focus on housing today. And housing has 2 primary strategies. So within this housing goal, we have 2 strategies. The first is affordable housing options and access, and the second is home and community supports. And so I'm going to talk about the first one and go into a little detail. Within these strategies, we have objectives. And we have objective A. The goal for this is to increase affordable age-friendly housing options for older adults and adults with disabilities. Maybe projects that you're working on already align with objective A. And if that's the case, it's a great opportunity to sign on as a partner since our work already aligns. Objective B is to simplify navigation of affordable housing options. This was very important. A lot of resources already exist for housing within the community, but figuring out how to streamline the navigation options when people can be very overwhelmed about what's available to them or how to find this information is extremely important. And then objective C is to support caregivers in need of affordable housing. One of the key elements that we found after speaking with both caregivers and actually quite a few of the people who are unhoused was that these individuals have served as caregivers for family or friends, informal often. And when the person that they were caring for passed away, they lost their housing that they were in. And that was it happened more frequently than I'd like to admit in those that were unhoused that we spoke with. And so this was particularly important, I think. So that's strategy one. Strategy two focuses on home and community supports. We also have three objectives here. The first one is to ensure older adults experiencing housing transitions have access to LTSS, or long-term services and supports. The second one is to improve the quality of care at adult residential care facilities, ARFs, residential care facilities for the elderly, RCFEs, and home and community-based services, HCBS. And then the third objective is to expand access to advocacy programs and services. Maybe your organization is already working on advocacy, or they could already be working on community-based services or ARFs. Or maybe they're already working on LTSS within San Bernardino or Riverside counties. If that's the case, we'd love to learn about what you're doing and figure out how we can support that existing initiative. So we're going to go on and talk about what potential partnership opportunities for Goal 1, housing as home and healthcare, could look like. It can look like conducting presentations or workshops with city and county leadership on ways to meet housing needs and different housing models. Or if you are city and county leadership, it could look like making space for these workshops. It can look like applying for funding to create user-centered affordable housing navigation services or other projects as well. Um, it could like hosting trainings with navigation organizations such as ADRC or 211 or Coordinated Entry, to build staff capacity to provide support for community members who are looking for housing supports. It could look like trainings for LTSS and coordinating that. It could look like advocacy for housing support or for family and friend caregivers. Or it could look like advocacy for LTSS and system to continue to receive funding. So much of the funding is being cut currently, and so advocating for any kind of funding to remain for these services is important and an opportunity for collaboration. It could also look like aligning a project your team is already working on or considering to work on related to housing and long-term services and supports. And it can also look like participating in improvement to services and navigation. We already have some projects currently going on that I'm going to share with you. Some of them are not specific to housing, but it can give you a little bit of insight into the types of projects that we already have partnership and collaboration on. For example, for our goal 5, which is safety, respect, and equity, we're working with Rolling Start they're already doing safety presentations in the community, but we partnered with them to apply for funding to expand their efforts so they can also continue to do these presentations for safety and emergencies, and then also provide emergency supply bags to communities and members that are taking these trainings. We're also working with Justice and Aging and CCLTSS, which is the California Collaborative for Long-Term Services and Supports, and finding individuals to share their stories about how Medicaid cuts impact them. And the Inland Coalition and the Aging and the ICRC is coordinating to share these stories and connecting them with media and doing these sorts of actions. So a lot of advocacy surrounding Medi-Cal and the Older Americans Act. For goal 3, which is caregiving, Alzheimer's disease, and other dementias, ICRC, Inland Caregiver Resource Center, is conducting trainings for Riverside IHSS providers and is also going to begin trainings in San Bernardino County in collaboration with our public authorities to do the same types of trainings on IHSS. Additionally, ICA is going to be presenting at the San Bernardino IHSS Training Summit in April. That's one way they're supporting Goal 3, caregiving Alzheimer's disease and other dementias. For Goal 2, PastTac is an organization that coordinates transportation. They're creating a user-friendly transportation guide for older adults and those with disabilities. It's being done in response in collaboration with the IE-MPA's goals for transportation. So maybe it looks like distributing this user-friendly guide or linking to it on your website. That's a way to collaborate as well. That way, community members can learn how to navigate the public transit while also reaching the resources that you're providing. And finally, some partnership activities can work on more than one goal. So, for example, ICA, Inland Coalition on Aging, and ICRC worked with the Black Resource Directory in putting on a conference in February called What's Really Going On, where there was a panel of speakers addressing mental health in African Americans and resources that were available to them. The goal aligns with Goal 5, which is safety, respect, and equity, and also Goal 4, which is behavioral health. So a lot of times there is overlap between the goals and between the actions that can happen and the ways in which we can partner. And so y'all are probably curious on what like next steps look like. If we want to go on to the next slide. Awesome. And I'm going to drop a link in the chat. There we go. Hopefully it works for everybody. So the ways that you can partner and what next steps look like are signing up as a partner. I dropped the link in the chat for y'all, so it's easy if you're interested in doing that. You can also join the Inland Coalition on Aging. The best way to do that is via our email group. We send out notifications for meetings that are going to happen. The website for that is inlandaging.org, which will be on the final slide. You can also commit to helping with IE-MPA implementation, which is what signing up as a partner looks like. If you need a potential follow-up meeting or if you need to bring additional information back to your office, we're happy to coordinate that and provide you the information that you need to feel good in signing up as a partner. And then additionally, you can connect us to other potential partners. Maybe there's somebody that you're working with that you think would be great. Connect us with them, and we're happy to talk with them about what partnership looks like. Additionally, you can attend the IE-MPA launch. That's going to happen in June, I believe June. I don't know the specific date yet, but it'll happen in June. And we'll be launching and promoting the IE Master Plan for Aging. And then you can also connect with us. If you have a project or a grant idea to collaborate on, you can email us at info@inlandaging.org. Oftentimes, partnerships strengthen funding proposals. So by demonstrating partnership with the Inland Coalition on Aging for the Master Plan for Aging and talking about that in a grant proposal, that can strengthen your proposal because it's working across sectors with coordinated efforts. So we're happy to speak about what that looks like. And we've already done one of those with another partner. So something we have experience for. Awesome. So hopefully we'll see you there. And we'll see you in our forthcoming action group meetings. We're hoping to start those in August, and we'll contact everybody on our partnership lists and start holding these meetings for implementation of activities. We want to specifically support existing efforts, advocacy, and projects that are already happening within the community. We know that these activities are already happening, and we want to bolster them further. And so that's a little about what partnership looks like with the Inland Empire Master Plan for Aging. We're going to go to the last slide. And if you're interested in signing up for our newsletter and to become part of the coalition, this is the website.